Even on Facebook. Have you watched?
A
Even
very good evening to all. Myself, Preeti Tagde, Founder President, Crisil Foundation, India. I welcome you all in an international webinar on reducing cesarean section rates by producing slimmer babies. I would like to welcome our first speaker, Dr. Ute Inekbenor. He is obstetrician, physiologist, and health educator in Nigeria. He did his doctorate from Benin, Nigeria, and also from UCN, Central University of Nicar- Nicaragua. He also did his Masters of Business Administration from Benin.
yes,
Welcomes Dr. Ene Enegbeno, and I would also like to welcome our panelist, Dr. C. N. Iketor. He did MD and doctorate. He is reproductive health educator, physiologist, and health educator. He is also a head of human physiological department, College of Medicine, Ambrose Ali University, Nigeria. Uh, I would like to welcome all the participants in this webinar. As we know that the fetal macrosomia commonly makes vaginal delivery hazardous to mothers and their babies. Furthermore, it often increases the rate of obstetric interventions and cost of childbirth. Even in addition, it poses a lifelong morbidity due to obesity, hyperlipidemia, diabetes mellitus, hypertension, even coronary artery diseases to affect babies and may also predispose to viscous cycle of pregnant obesity and macrozomic pregnancies. So, in that view, a large babies can result in hazardous deliveries. There is, and therefore, a need to control a weight, especially in mother predisposed to macrozomic pregnancies. So when I discussed with Dr. Ute few months before, he sent his work on the producing slimmer babies for easier vaginal deliveries by Dr. Ute, and this work is really very much appreciated. So due to this pandemic condition, we have planned the session by our experts, Dr. Ute, so that each and everyone should know what are the how we can come up with this slimmer babies production so that we can reduce the cesarean rates. So once again, I would like to welcome Dr. Ute.
okay. Thank you very much.
I'm just sharing your presentation.
Okay.
Okay.
Yeah. I start.
It's visible over there, the slide.
Cesarean section rates expedite delivery. However, it is in many instances abused.
Doctor, slide
Cesarean
is
section
visible.
rate. I'm starting.
Dr. Ute, slide is visible.
Okay. I'm invisible. It's because of the mistake.
Just give me a second. I think it's not visible. I'm just connecting.
Can I remove this from slide?
Wait. I am just sharing. Yes, perfect. Now you can start. You have start.
Cesarean section expedites delivery. However, it is in many instances abused. Cesarean section rates may be as high as 50% in China due to previous restriction policy on childbirth. Recently, there's been a slight reduction because of the relaxed policy on childbirth. The rate of 32.7% have been found in USA and is due to the fear of litigation of the doctors, whereas in Brazil, rates of 47% are common, and this is because of commercial reasons. The doctors feel that they should not waste their time taking a delivery when they can actually just within 1 hour do a cesarean section and get the baby out and get more money. In Nigeria, rates of 5 to 40% have been found in different facilities. It is high in private hospitals for commercial reasons and is low in district hospitals, but moderate in mission and teaching hospitals. In India, it's about 9%, but it is variable. The World Health Organization has recommended that it should not be more than 10 to 15%. However, there is an increasing trend for cesarean sections. When cesarean section rates rise towards 10% across a population, the number of maternal and newborn deaths decreases. But when the rate goes above 10%, there is no evidence that mortality rates improve. Cesarean sections can cause significant complications, disability, or death, particularly in settings which lack facilities to conduct safe surgeries or treat potential complications. The indications for cesarean sections include cephalopelvic disproportion, obstructed labor, imminent uterine rupture, prolonged labor, cervical dystocia, malpresentation, fetal distress, and placenta previa. Others include two previous cesarean sections, combined indications such as one previous cesarean section and breech presentation, severe preeclampsia, eclampsia, cord prolapse in the first stage of labor, and cord compression and fetal macrosomia, which is the main thing we are going to discuss today. The factors that contribute to high cesarean section rates include social factors, fear of litigation, assurance of survival of a previous baby, pressure from patients and family members, financial gain to healthcare providers, poor management of labor, and lack of knowledge of the pathograph. Fetal macrosomia has been defined as the 90th percentile of birth weight in a population, irrespective of gestational age. This can be a determinant of maternal and fetal morbidity. However, a specific birth weight is a better benchmark for predicting maternal and fetal morbidity. This varies in different races and countries as follows. For
Doctor,
example,
sorry to interrupt you. If you you can say next if the slide has changed your content. You can say to next like if you feel okay.
okay, so it is 3.25
Yeah, it's
kilograms.
need of reducing cesarean section rates. Okay,
Did I go back?
go back. Okay.
Okay. Fetal macrosomia has been defined as 90th percentile of birth weight in the population, irrespective of gestational age. And this can be a determinant of maternal and fetal morbidity. However, a specific birth weight is a better benchmark for predicting maternal and fetal morbidity. This varies in different races and countries as follows. Next slide. It is about 3.25 kilograms in India, 4.06 kilograms in Algeria, and 4.5 kg in United States of America. In Nigeria, 4.0 kg is currently being used as a benchmark. Next slide. The prevalence of fetal macrosomia has been found to be about 3 to 15% worldwide. The prevalence is variable in different parts of Nigeria. For example, in southern part of Nigeria, where you have Enugu, Port Harcourt, Benin, and UBT Benin and St. Philomena's, you have rates of 8.1%, 7.4%, 5.4%, and 8.4%. 8.4%. However, in northern Nigeria, the prevalence rate is about 4.2%, like in Zaria. Next slide. The contribution of large babies to cesarean section rate is variable. In the study in Nigeria, the cesarean section rate in mothers of macrosomy babies was 39% compared to 18.8% in mothers of normal babies. In another study in Turkey, the cesarean section rate was 37.3% for the mothers of macrosomy babies compared to 25.3% for mothers of normal babies. The consequences of fetal macrosoma in the mother include disproportion, which may be cephalopelvic disproportion or fetopelvic disproportion, depending on the presentation of the fetus. Dystocia, prolonged labor, postpartum hemorrhage, maternal injuries, which include perineal tear, such as third-degree tear, and then obstetric fistulae, such as vesicovaginal fistula and rectovaginal fistula. Next slide. In the fetus, the consequences include fetal injuries, such as brachial injuries, which include S palsy and concave palsy. There could also be injury in the brain, which will result in cerebral palsy. Other complications include birth asphyxia, low Apgar score, and metabolic syndrome, which is a constellation of diseases such as hyperlipidemia, hypertension, diabetes mellitus, coronary artery disease, etc. Next slide. You can see a picture showing a macrosomy baby compared to a normal baby, just by the side. There is therefore a need to have slimmer babies. And to have slimmer babies, you need to avoid fetal and maternal complications. There's a need to reduce cost of childbirth and producing healthier babies so that if you reduce cesarean section rates, there will be, and during the cesarean section itself, you could have easier operative deliveries. The policy of elective cesarean section in suspected cases of fetal macrosomia has, however, not reduced the incidence of brachial plexus injury, which is the main cause of litigation in obstetrics. Next slide. In order to predict the birth weight of a fetus, ultrasound, scan, and clinical examination are the main methods, and they have been said to have equivalent predictive value. However, in obese mothers, the ultrasound has been said to have a higher predictive value. Next slide. This shows a pathophysiology of fetal macrosomia. Here you can find that the mother develops hyperglycemia, and then because of that, there is increased flux of glucose from mother to fetus, which results in fetal hyperglycemia and thereby stimulating the fetal pancreas to cause fetal hyperinsulinemia, which causes increased metabolic rate and hypoxemia. There's also a redistribution of cardiac output, increased release of norepinephrine and blunted release of glucagon. In this process, you find that there's more fat stored in the adipocytes, and then there's also an increase of glycogen in the liver. The heart may also develop asymptomatic septal hypertrophy. Lung metabolism is also altered to delay the production of surfactant, which is responsible for the maturation of the lungs. Well, this is a flow chart showing what we have just talked about, but In the next slide, I will discuss everything. So just look at the flow chart showing that fetal macrosomia can result from maternal diabetes, and therefore there can be fetal hyperinsulinemia, and that may result in neonatal hypoglycemia. But looking at the other side of it, you find that the fetal hyperinsulinemia causes beta cell hyperplasia, and then because of what normally happens with the more glucose entry and the rest, an increase in fat mass, an increase in muscle mass, an increase in size of bones, you find that there is macrosomia, and then this may give rise to birth trauma. It can also lead to cardiac hypertrophy. Next slide. Maternal hyperglycemia results from diabetes mellitus or overnutrition, which is excessive intake of high glycemic index diet or sugary beverages. And this stimulates fetal pancreas, which increases fetal insulin release. Next slide. There is therefore a facilitation of glucose and amino acid entry into the fetal tissues, which causes an increased muscle mass and increased fat mass, as explained earlier. And there's also an increased bone growth, especially the shoulder bones. The next slide. Here are preventable and controllable causes of fetal macrosomia, which include diabetes mellitus or gestational diabetes mellitus. Also, you have pregravid obesity and gestational weight gain. Now, these methods for producing slimmer babies will include pre-pregnancy counseling, and then so that you can have early diagnosis of diabetes mellitus in would-be mothers or potential mothers, so that there's now a need to regulate blood glucose to avoid hyperstimulation of fetal pancreas earlier in pregnancy. Also, there could be monitoring of fasting blood glucose every trimester. That's to detect gestational diabetes mellitus. And there should also be control of fasting blood glucose when gestational diabetes mellitus is detected. Other methods for producing slimmer babies include nutrition education, which includes also you have monitoring of gestational weight gain and antenatal counseling to enable gestational weight gain fit into the guidelines recommended by Institute of Medicine, as shown in the next slide. Looking at these pictures, you find this graph here, you find that, or this table, you find that a woman who has normal weight should take less than 0.5, should gain less than 0.5 kg of weight per week, and not less than 0.35 kg per week. A woman who is overweight should gain not more than 0.33 kg per week and should not gain less than 0.23 kg per week. Whereas obese woman should gain not more than 0.27 kilograms per week and not less than 0.7 kilograms per week. Next slide. Now, trying to emphasize the nutrition education. Here, we have to restrict calorie intake to 2,000 calories per day in mothers. And then there should be avoidance of sugary beverages throughout pregnancy. Here in Nigeria, it is found that it is often advertised that people should take more drinks per day, every day, and pregnant women are not spared. You find that these pregnant women end up taking a lot of sugary drinks, and for that they begin to have fetal macrosomia. And when it comes to delivery, most of these women are poor and they cannot even afford the cost of cesarean section. Now, these women should also take low glycemic index diets such as beans, unripe plantain, and pear. The pears include the normal white pear that is being sold at this season, and then avocado pear. There should be minimal consumption of high glycemic index foods such as pasta, white rice, white bread, and Irish potatoes. When high glycemic index diets are consumed, there is a need to add plenty of vegetables and other dietary fiber to minimize post-digestion absorption of glucose. Next slide. Now I come to the area of scientific prospects. This involves extrapolation of results of previous experiments with rats. And then here I'm talking about specific protection of susceptible women, that women who are obese, women who have increased gestational weight gain, and those women who are overnourished, so that they can have something that they can take to prevent fetal macrosomia. Now, in the rat experiment, it has been found that alligator pepper, next slide, intraperitoneal injection of low doses alligator pepper at first trimester pregnancy was found to reduce litter weight of normal Sprague-Dawley rats. And it was also found to reduce the litter weight of alloxan-induced diabetic Sprague-Dawley rats. Also, it was also found to reduce the litter weight of high glycemic index diet-fed Sprague-Dawley rats. Now, next slide. And the probable active ingredient of alligator pepper was suggested as beta-caryophyllene. Beta-caryophyllene is an approved food additive in the United States of America, according to Gersh and Fiorenzani. Therefore, we are suggesting that this could be used as a vaccine or food supplement. Next slide. I now go to the physiological basis of how the vaccine is intended to induce slimming of babies. Now, this drug is supposed to cause insulin depression or reduction in mother rats, and then reduce glucose entry into fetal compartment, which will cause a reduced amino acid into fetal compartment and a depressed stimulation of fetal pancreas. There will now be lower insulin secretion by fetal pancreas and reduced longitudinal bone growth in fetus. There should also be reduced fat mass and muscle mass and body fluid. The result is slimmer fetus and lower birth weight. Now, next slide. Beta-caryophyllene may cause lipooxidation, since by lowering insulin levels, it causes disinhibition of triglyceride lipase and enhances lipooxidation. It may also activate type 2 cannabinol receptor by selective agonist, which promotes lipid oxidation through signaling and transcriptional pathway. Next slide. In conclusion, large babies can result in hazardous deliveries. There is therefore a need to control birth weight through nutrition education for pregnant women, and then monitoring of fasting blood glucose each trimester of pregnancy to detect maternal diabetes mellitus and gestational diabetes mellitus. There is also a need to refer subsequent cases of fetal macrosomia to hospitals with better facilities and experienced doctors. Next slide. Babies could be made slimmer by early diagnosis and treatment of diabetes mellitus during pre-pregnancy counseling. And there should be early diagnosis and treatment of gestational diabetes mellitus by antenatal monitoring of fasting blood glucose in all trimesters of pregnancy. Next slide. There should also be maternal nutrition education involving use of low glycemic index diet during pregnancy and avoidance of excessive injection of high glycemic index diet during pregnancy. Avoidance of excess injection of sugary beverages during pregnancy, and addition of dietary fiber to diet during pregnancy. Next slide. Specific protection in the event of a new drug discovery from the extract of alligator pepper, which is Aphramomum meligueta, can be used for food fortification or food supplementation or vaccine. I'm therefore suggesting that women who are predisposed to fetal macrosomia could be given food supplement or vaccine if the active ingredient in alligator pepper is suspected to be beta carotene is found to be active in pregnant women. Thank you for listening. Next slide. Following are the references.
Thanks, Dr. Ute. And meanwhile, what I observed in your presentation is like something the producing slimmer baby. That's all relevant to the food supplement and what are the like these conditions. So in that sequence, one question has came in my mind that which of the trimester will be most appropriate to give the aqueous substrate to the human that will have more beneficial effects to the fetal weight with reason.
The, the trimester that will be most appropriate would be the first trimester, because in the rat experiments, the alligator pepper was given intraperitoneally on the 4th day of gestation, which corresponds to the first trimester of pregnancy in humans.
Okay. So shall we invite our panelist, Akatar, Dr. Akatar? Dr. Akatar has joined.
Okay.
Dr. Ute,
It's
he
okay.
has joined.
Yeah. Okay, I can become a man.
Can you unmute?
Huh? Unmute. Can I unmute? Okay. I think I
You
should
can
come out first.
invite him, Dr. Akatar.
Unmute where? Huh?
The
No.
Dr. Akatar has joined us.
Hmm?
Okay. No issue. Sir, I just wanted to know that there are so many factors that leads to the fetal macroscomic pregnancy. That's somehow relevant to the high sugar level and everything. So, can you please brief about this point also?
Okay, darling.
The condition.
Please, can you repeat?
You are unmuted. Don't worry, you are unmuted. I just wanted to know that what type of food we need to avoid during the like pregnancy, as you told that the main role is like people as having the diabetes mellitus and other diseases, that is so much relevant to it.
Hmm? Can't get you well.
So you're not getting.
No. Please, maybe Dr. Ekato might be able to ask me. Let him ask me. Your screen on the line. Let the screen listen. Where's my phone?
What supplement you can prescribe?
Supplement.
Yes.
The supplement that I'm talking about, we have to come from the extract of alligator pepper. I have suggested beta caryophyllene because
Okay.
that is what is already being used in America and it's also found in alligator pepper. It's also found in cannabis sativa.
Okay. And another thing I just wanted to know that causes and risk factors.
Causes hmm, risk factors. Risk factors of the risk factors of fetal macrosomia.
Yes.
The risk factors we already discussed that, and that includes um, maternal and fetal injuries. Okay,
Oh.
the risk factors. Why would somebody have fetal macrosomia? They are common in people who are obese and people who develop excessive gestational weight gain, and it's very common in people with diabetes mellitus or people who are overnourished. Those who take sugary beverages every day, every minute, they are just like people who are diabetic because the glucose is always high in the blood.
Okay. What about is it genetical any correlation?
Scientific correlation,
Genetic, hereditary genetic.
genetic. Okay. Okay, some people are genetically predisposed to fetal macrosomia, but on the average, like for example, it is said that male children tend to develop macrosomia more than female children. But however, these things can also be prevented even if they are genetically predisposed. If you still control many of these things that I've discussed, like controlling diabetes in those who are predisposed or eating the low glycemic index diet during pregnancy, it is still possible to reduce the birth weight.
Okay. That's what I wanted to know. That, and next, I just wanted to know, sir, uh, what about the PCOD, polyovarian cystic disorder, role in this condition?
Please repeat.
There are so
Please.
many patients who is having the problem of PCOD.
Problem of
Yes, problem of PCOD.
I can't get that.
You're not getting my question.
No, I didn't get it. Please let me write it and say.
I'm just asking, sir. I'm just asking about the menstrual disorders, like those who are having the polyovarian cystic disorder. So might be there is a high risk of this condition. It might be.
Hiding stuff.
Uh, I'm just writing. Just wait.
Please, I don't know if you put. Huh? Okay. 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 You are talking about menstrual problem
Yes.
concerning what about menstrual problem? whether it has to do with fetal macrosomia.
So actually, many females has wrote me. Kindly ask sir about this question.
Okay, I'm sure what you are saying, PCOS,
Oh yes,
polycystic
yes.
ovarian disease, is that what you are talking about? Yes, that's a complication of females who are obese. Females who have fetal macrosomia may end up having polycystic ovarian
Cystic
disease.
disorder.
They may end up having that. So, and except they are treated, they may now develop infertility.
Okay. Uh, uh, I ask any of the participants if you guys have any of the questions relevant to our topic or gynae issue. So you may write on a chat box. So that will be okay because the voice has issue. Okay, doctor, can what message you wanted to give to all the audience or the participants?
Yes. What I want to tell all the participants
Yes,
is
I want you since you are connected here. What message you wanted to give all?
the message to participants
Yes.
that on the average, we see a lot of women abusing soft drinks and eating just any kind of food they want to eat during pregnancy. I'm telling the participants that, especially the doctors and nurses, that whenever a pregnant woman comes to the clinic, they should actually advise do a kind of nutrition education so that the women learn to eat foods with low glycemic index diet. These women should also be screened every trimester of pregnancy. I've asked questions in hospitals around, and I found that on the average, apart from doing urinalysis to find out if somebody has uh, blood glucose, urine glucose, nobody goes ahead to go and do fasting blood glucose. And even when they do, it is just once in pregnancy, whereas gestational diabetes mellitus can occur at any time during the pregnancy, especially as from 28 weeks. So it is necessary to do the fasting blood sugar at least every trimester of pregnancy, or if it were possible, every antenatal visit, so that it is you have early diagnosis of gestational diabetes mellitus in order to be able to treat them. But
Uh,
also, most women who are interested in pregnancy should be screened for diabetes mellitus early enough so that appropriate treatment can be started in order to prevent these babies becoming macrosomic. Because if you do not treat the diabetes mellitus and these babies even get a little bit of the sugary or sugar influx into the fetal compartment, you find that according to Peterson's hypothesis, the fetus will continue to enlarge even when only very little sugar now gets to it. So it's better to discover this thing early enough so that at the first trimester, you are already able to control the the blood glucose. And then women should also be monitored. Those women, all these advertisements concerning people should take uh, malt drinks, which is sugary beverage, every day should be stopped, because actually in order to make money from the people, you're actually endangering people's life. Another problem is that the females, once female become they become macrosomic, When they grow up, they also give birth to macrosomic babies, and then it becomes a vicious cycle of macrosomic mother giving birth to a macrosomic baby, which if it's a female we also give birth to a macrosomic baby, and all these vicious cycles should be broken.
Thank you, sir. This is very much important to know that what good habits we need to adopt, and we need to avoid such drinks and all this thing because it contain high sugar content. So thank
Yes.
you. And I just wanted to ask some prenatal care about the prenatal care.
Pre
Yes, prenatal care.
Pre-mother care.
Prenatal care. I'm just text you.
Yes, thank you. Okay, prenatal care. That's antenatal care. Yes, it is during the antenatal. People, women should learn to book early as against what is happening at the moment. Most women believe that they should book at the second trimester of pregnancy, but a woman who is going to develop fetal macrosomia would already have been engineered to develop it at the first trimester. So it is best as soon as they miss their period, they should end up going to book in the antenatal clinic so that they can be taken care of. And it has been said that we should make sure we monitor their glucose, we should make sure we give them nutrition education, and then also control diabetes mellitus if they have any, and prevent them from taking excessive care. Normal routine antenatal care drugs should be given as usual.
Yes. Second, Dr. Utte, I just wanted to know that since it's like very common to see high blood pressure is common during the pregnancy, what to do in this?
Yes, whenever a woman has excessive gestational weight gain, uh, there is an increase in insulin level. Insulin has a way of causing oxidative stress and also causing an increase in blood pressure, thereby sometimes giving rise to pre-eclampsia, which is quite common in Nigeria. So, and many of these women also who were born as macrosomic babies, if they are females, a part of the problem of polycystic ovarian syndrome will be hypertension, and which is high blood pressure. That is also very common in women who are obese because they also have maternal hyperinsulinemia, and this is the insulin causes increase in blood pressure.
I'm just adding Dr. Eketobor.
Hello.
I'm just adding him. Yeah, yeah, just I'm typing. Just I'm typing. Can you just brief about the preterm labors
Yes, preterm
and
labor.
how they will be aware, because there are so many women they are not aware of all this thing. And one example I just found that she didn't know about this condition, and her baby has died. So I just wanted to know about this.
Yeah, preterm labor is said to occur when labor starts before the 37 completed weeks of pregnancy. And we find that many women tend to stay at home if they don't have any serious severe pain, so that by the time they get to the hospital it becomes too late. Another way, you could have um, some drainage of liquor, which is preterm, and that also, through the drainage of liquor, you could find that there's ascending infection causing fetal sepsis, and then sometimes causing fetal death. But if the mother gets to the hospital early, and once the pregnancy is above 34 weeks, 34 completed weeks of gestation, it is believed that the surfactant level is already adequate for delivery, and such patients could be induced. But even sometimes when it is a bit lower than that, dexamethasone may be given to induce fetal lung maturation.
Oh, okay. Dr. Ute, I'm just want some break. I'm adding Dr. Ekebetor. You need to on your video, doctor.
Yes,
You are added by TechnoSpark 3 name. You need to unmute and you start your video.
please.
See, doctor, as we see that there are more relevant cases of the miscarriages.
Yeah, miscarriage is a term used to describe pregnancy loss. Yes. Actually, miscarriage is a layman's word for spontaneous abortion. The- And abortion is said to take place when there is termination of pregnancy before the age of viability. The age of viability is different in different areas, depending on the facilities they have. For example, in United States of America, age of viability could be taken as 20 weeks, whereas in Nigeria, the age of viability is 28 weeks. If a woman goes on to abort before the age of 8 weeks in Nigeria, in some teaching hospitals, maybe about 26 weeks, it might not be possible for that baby to survive. But in places like United States of America, a baby which is about 20 uh, no, which is about 20 weeks of gestation might be able to survive through the use of incubators.
Okay. Okay, now we have a panelist. I would like to welcome Dr. C. and Akator. He is a reproductive health educator and physiologist. Welcome, doctor. You are not audible. You are not audible.
I'm not audible anymore.
No, no, no. You are audible, Dr. Ute. I'm asking about Akator. Akator.
Okay.
No, 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 not audible. Dr. Akator, say something. Okay, okay, now okay. There is a background music, Dr. Akator. Yes, 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 just perfect. You need to unmute. Okay, he has went. No issue. Dr. Uday, you need to unmute. Okay, now okay. What about steel boats?
Seabed. Yes. When we say somebody has seabed, it is when the fetus dies after the age of viability and before 10 or even at 10. That is when a fetus is able to get above 28 weeks, for example, in Nigeria, or 20 weeks in the United States of America, and dies maybe at birth, just without any sign of life at birth. We call that one stillbirth.
Oh,
And it's very common in diabetes mellitus
oh my God.
because
It's
of
really risky one.
because of the hypoxia that may result.
I just wanted to know that now, as already we discussed about the PCOS, so what hormonal imbalance that it seems to be more the hormonal imbalance.
Hormonal imbalance that can occur in where? In stillbirth.
So thank you, doctor, for giving the your deliberation. I just wanted to last. My last question is that during COVID-19 pandemic, what cases you observed in COVID-19 pandemic, the pregnancy, like you are handling the cases. So what seems to observe the conditions and the complications?
Complications of COVID-19 on pregnancy.
Yes, definitely.
Okay. Now, COVID-19 has turned out to be a very dangerous disease, which actually causes, uh, according to the Italian doctors, it has been found that COVID-19 actually causes a kind of fibrosis of the lungs, and that it also causes a disseminated intravascular coagulation. So that during this period of COVID-19, pregnant women especially should avoid uh, moving with people who are infected, or and they should observe all the rules, try to wash their hands and isolate themselves as much as possible. Otherwise, the problem they will have is that since they are already in the hypercoagulable state during pregnancy, and now we say COVID-19 is also causes disseminated intravascular coagulation, pregnant women are more likely to succumb to disseminated intravascular coagulation. And the pregnant women therefore will need to take aspirin as prescribed at least 75 milligram on daily basis throughout pregnancy.
But that is not good for the health. The aspirin you are talking now. So is it okay for consume?
That aspirin is not good for.
Yes.
Aspirin is that is not good for the health of the baby.
Okay.
Aspirin is actually prescribed for people who are hypertensive and who have preeclampsia in order to reduce this hypercoagulable state.
Uh, n-
So
Now
there's
one
nothing
question
really
has
wrong with
been came in
lifetime.
Facebook Live, that what you seems to be by producing slimmer baby. So I thought you have your uh, uh, article also in this work, producing slimmer baby.
Producing slimmer babies
Yeah.
will make deliveries much easier. And even when they have cesarean section, the fetal extraction is much easier. For those who are experienced with this, those who have done cesarean section for people with macrosomic babies, you find that sometimes you almost end up tearing the uterus in different directions in order to extract the baby. And that is not good enough for anybody because the trauma is much. But if the baby is slimmer and first is likely to have a better delivery. If during induction, the baby is likely to negotiate the process of labor more easily. Whereas if it is macrosomic, uh, because of cephalopelvic disproportion and the very fact that the biparietal diameter of the fetus might now be bigger than the anteroposterior diameter of the pelvis, you find that this woman might not be able to deliver the baby. So it is best to slim a baby down so that all parts of the body go down. Also, a major complication is shoulder dystocia because the bones of the shoulder particularly become very long with fetal hyperisolemia. And when they become very long, they tend to hang during second stage of labor, in which case the head is delivered, but the fetus cannot be delivered. People who are not experienced end up pulling at the baby, and at the end of the day, they strangulate that baby. But sometimes, for those who are experienced, you'll be able to try to deliver the posterior shoulder and then force the baby down, and then be ready with oxygen to be able to resuscitate that uh, baby.
Thanks, doctor. Thanks. Uh, s- it's really like whatever the queries they have, you have sorted out so much at high rates. We take like the sugar consumption and like diabetes mellitus and hypertension. These are the main causes. So we need to be like uh, control all these parameters, and it's a really good work you are doing over there. So I saw your that review article also. So thank you so much for coming and sharing your knowledge with us. Thank you once again.
Thank you very much.
Thank you so